Welcome in Evelyne Dumas room from the Quebec Parliament. Welcome to this press conference of the Premier Quebec, Mr. Legault, and the National Director of Public Health, Dr. Horatio Arruda, and Mr. Christian Dubé, the Minister of Health and Social Services. Yes, hello. Thank you. Hello, everyone. Before speaking to you of the pandemic and the situation of the pandemic in Quebec, I wish to say a few words on the U.S. elections, even though we still don't officially have a winner. I think that we can still already draw some lessons from those results. I have seen, and we have been able to see, that many people were surprised to see the very small gap in the votes between Mr. Biden and Trump. People have been surprised to see how many people voted for Mr. Trump, and of course we all ask ourselves questions about what this reveals. And I think that it shows, amongst other things, I'm saying amongst other things, a very great economic anxiety. A lot of citizens are asking themselves questions on their jobs, particularly those jobs that pay well. Let's remember that everywhere in North America, jobs in the manufacturing sector, amongst others, pay a great deal better than average jobs. And in Mr. Trump's speech, he did, in fact, talk quite a bit about his exchanges with China in order to bring back to the United States a part of the manufacturing sector. And I believe that there are a great many people who either already have a job, still have a job, but are scared of losing it, or who have lost their job in the manufacturing sector. And I think that it's a great concern. And I think that we can apply the same thing here in Quebec. The other thing that we have to say to ourselves, regardless of who wins, whether it's Mr. Trump or Mr. Biden, the United States will always remain a very, very important partner, crucial, in fact, for Quebec. I'll just give you a few numbers. Quebec right now, when we look at all of those international exchanges that we have a deficit of about $10 billion per year with the world at large. If we look at what it is with the United States, there's a surplus of $20 billion. That is to say that if Quebec did not have exchanges with the United States, we would be speaking here of a commercial deficit of $30 billion with the rest of the world. So we can see the importance of that surplus of $20 billion. Of course, we cannot forget on one side or the other, whether it's Mr. Biden or Mr. Trump, all of that protectionist rhetoric that we're hearing about right now. That must bring us and the federal government, to deploy a great deal of efforts to get closer eventually with the new government, or if it's the same, as well as with the different states, with the different governors. And this is something that we've started already. I think that we have always in Quebec had good relationships, and we continue keeping up with them, with the northern eastern states, for example, Governor Cuomo in New York and Charlie Baker in Massachusetts. But now we have to go further. I had the opportunity in the first 2 years of being able to meet Mr. Newsom, the governor of California, as well as Mr. Abbott, the governor of Texas. And I believe that there is an opportunity here, an exceptional opportunity, of being able to increase our exports in those two states, amongst others. We can see, for example, in Texas, there's extraordinary growth. So we are thinking about the different ways of better working with those states. And I think, once again, that the United States will remain our great partner. We can have very beautiful speeches on the fact that we would wish to be less dependent on the United States because we have over 7% of our exports from the United States. But even if it's only having to do with the geographical proximity of the two countries, there will always be work to be done in order to be able to keep that commercial surplus. There are efforts to be made, politically speaking, as well, and we will be doing this. One last word on the results of the U.S. election. Of course, you can see that in the United States, people are very divided, 2 or 3% gap only. So it's good for no one, and it adds to the anxiety that was created, and that is always created by the pandemic. So I really wish, and I think that we should all wish to the U.S. people a soothing of those tensions between the two groups of citizens. This being said, I'd like to come back to the pandemic in Quebec. Today we have 1,138 new cases, 28 new deaths. It continues to be difficult, and it continues to be difficult particularly in two regions, the Saguenay-Lac-Saint-Jean and Lanaudière-Nord. When we look per capita, those are the two worst regions right now, Saguenay-Lac-Saint-Jean and Lanaudière, the northern area. And I have asked the health minister and even public security minister whether there isn't anything that we could do to help them more in order to reduce the number of new cases, in order to better apply the guidelines in these three regions. So there are really problems in the Saguenay-Lac-Saint-Jean and in Lanaudière North. Now, I'd like to come back on the proposals that have been made by different people, including the Montreal Public Health, in order to ask for a certain loosening of our restrictions. First, let's remember that today, or yesterday, if you will, the data that we published today, which were for yesterday, do show 271 new cases in Montreal. So the fight is not yet won in Montreal. Second thing, in the way that we work, we have to understand that the public health of each region emits the recommendations to the National Public Health Director, and then the Director of Public Health comes and presents to us what those recommendations are. And we debate them. But it is important to remember it is the government at the end of the day that makes the decision. And as I have repeated, and Christian repeated it as well, since the beginning of the pandemic, we have always accepted the recommendations for restrictions on the part of public health. Even in certain cases, we went even further than what public health was suggesting. And it's a responsibility, whether we want it or not, that we have to accept that of finding that balance. It's a balance that is difficult to find between life, saving lives, and on the other hand, the quality of life of all Quebecers. So we look at it region per region. We look at the trends elsewhere, because let's remember that during the first wave, what happened in Europe then happened here. So we're also looking at what is going on over there. But it is very important to say it's not an exact science. We may look, there is no operational guide on how to manage a pandemic and how, at what moment to make which decision. But having read quite a bit of it, spent quite a few days and evenings and nights, even in the past 8 months, I think that one of the conclusions, one of the lessons that we can learn, is that the great challenge that we have is to avoid gatherings. Very often, in many domains, it's the 80-20 rule. There are a few people who infect many people. So that is what we have to avoid. Because if a person infects another person, that is one thing. If a person infects 10 people, well, you can see that it very quickly becomes exponential, and that is the problem that we are trying to avoid, and that is the reason why, at the moment, we are choosing in red zones to keep restaurants, gyms, rooms closed, because these are opportunities of people gathering, not only inside the room itself, but at the entry, at the exit, any performance hall or theater. This is a message that we don't want to send out as long as we are not with a better control. So no gathering. However, I understand very well that there are people right now who are developing all sorts of mental health problems because it's been a good while now that they cannot see other people. First, I'll remind you, because there are people who are forgetting, the people who are alone, regardless of their age, have the right to have the visit of one person at a time. It's important to remind us of that. However, I see the case, for example, of students at college, at university, who have been taking classes at a distance for a few months, who live with their parents, so we can't say that they're alone. But if their parents are at work, they're alone during the day, and who are really missing the opportunity of seeing their friends. So I have asked my team to look at the possibility of perhaps having a loosening that would be more for individual meetings. Could a young person meet with another young person? There could be perhaps meetings, but one at a time, one person at a time. However, and I want to repeat that for the time being, we do not believe that it's a good idea to open up restaurants, to open up gyms, to open up concert halls or theaters, because these are opportunities of gathering and infections of many people at a time. So I would like to conclude by saying there is no answer, there's no guide. And I can assure you that every single day, I question the decisions that we'll have taken. And I speak with as many people as possible and accept everybody's advice. And I try to do what I can. I'm not perfect, but I try to do what I can, the best possible, to be able to take the best decisions in order for the common good for all Quebecers, and to find that balance between saving lives and offering quality of life that is reasonable or acceptable to all Quebecers. And I'd like to take advantage of this opportunity to thank Quebecers for their trust, for their support.
Good afternoon, everyone. The situation continues to be worrying, especially in two regions, Saguenay-Lac-Saint-Jean and north of Lanaudière. We must do a special effort in these two regions. We're also looking to send more resources there. As for Montreal, we must stay careful. The battle is not won. We'll discuss any possible lifting of restrictions with national public health authorities. What we're trying to do is to find a balance between saving lives and our quality of life. This balance is not an exact science. There's judgment involved. And when we see what's happening in the rest of the world, we see that the greatest challenge is to avoid gatherings. If you infect 10 persons in one gathering, it becomes exponential. That's why at this moment we've chosen to maintain our restrictions. We think that the risk of gatherings is too great at this moment. But I understand that it's very difficult for some people, so there's also a risk for mental health. People living alone can already receive one person at a time, and I've asked to evaluate the possibility of allowing meetings between two people in all cases. So we must continue to find this balance between saving lives and our quality of life, and I want to thank you for your support.
Merci. Nous allons amorcer la période des questions.
Thank you. We will now start with the question period. Hello. My first question is for you, Dr. Ruda. First of all, why not have transmitted the recommendations of the Montreal Public Health to the government? Why choose to remain with the measures that we have right now? Well, first, we have to understand that the work that is done is a teamwork with all public health directors, and we have to have a certain level of coherence and consensus among ourselves. It has to be understood that the documents that Dr. Drouin wrote, some of them are written, some of them we speak about, and that is a working document. And then we talk about it, and the final position is with everybody's consensus. You know, we work on confinement measures, deconfinement measures. We've been working on that for months. There's been a lot of discussions taking place, a lot of thought process. Even the following data that we'll have in the following weeks will help us know whether we go forward or whether we go back. And so it's just because it's not over. The discussions are still going on, I swear. And we just haven't presented everything to the authorities as such. It's in that sense. Because as I was saying, in order to have a consensual position, very often as close as possible to the decision-making process, because the epidemiology affects things a lot. And after that, we give it to the government who makes their decisions. Another question. In the spring, we had the problem in Montreal, and after that we had a problem in Quebec City. There was the week off, the spring break, and now in the Saguenay. What's the problem with the Saguenay region? Did we wait too long to put the Saguenay-Lac-Saint-Jean region in the red zone? No, I don't think that we waited too long. I think that every place has its differences and its reasons, and I think that right now we have to be able to also look on the side of care environments, hospitalizations, because what happened in the Saguenay region is that there was a lot of community contagion, which unfortunately went into hospitals, and that contagion at the moment puts at risk our entire hospital system of that region in particular. And since the distances are important between Saguenay and the Quebec region, we have to be able to care for our people properly. But there's also been movements that were perhaps made between people in Quebec and people in the Saguenay or Lac-Saint-Jean regions that may have led to that. So I think that was the right decision when we saw the trend and we saw the number of outbreaks increasing in that area, particularly in Alma. Unfortunately, Alma was more affected. So I think that it was the right decision, and we're going to be following that very closely in the next few weeks. But once again, we have an example here of a region that had not been affected at all during the first wave, a little bit like what happened in Quebec. And I think that people locally have reacted very well since the announcement that we made. And I repeat very often the same thing, but if we were able to see an improvement in the Saguenay-Lac-Saint-Jean region or in the northern Lanaudière area while we have a stabilization of our cases elsewhere, that would be the best case scenario. So I think that the people from the Saguenay region or Lac-Saint-Jean have to encourage themselves, because when we take those measures and we follow them, we can see an improvement. That's where we're at today. If you'll allow me, I asked myself the same question, and I asked the question to our own MLAs. We have some in the northern area of Lanaudière and the Saguenay-Lac-Saint-Jean, and they asked the question to their citizens. And the only answer that we have right now is perhaps the fact that they were perhaps very little or even not affected during the first wave, and it developed a feeling where they felt invincible. where they did not feel vulnerable to this. Because when we look, for example, at Lanaudière Nord and Lanaudière South, well, Lanaudière South, we're speaking here of Terrebonne, Mascouche, Repentigny, the large cities close to Montreal. They had been very affected in the springtime. So they learned their lesson, and now they are very prudent this fall. However, if we look at the north of Lanaudière, well, they had been very little affected in the spring, and they thought that they were safe from that. And it's a little bit the same thing in the Saguenay-Lac-Saint-Jean. Anyway, that is what I've been told by the MLAs over there. Hello to all three of you. Dr. Arruda, following what we can read in our recommendations concerning the Montreal region, the loosening, slackening of the measures that is being requested, and what the Premier mentioned, about the high-level anxiety in the public, do you think that there's a mental health crisis right now in Quebec? Any pandemic phenomenon such as we're experiencing right now with unpredictability, with rates of mortality, create concerns. And there are probably people who are more stressed out, who are more worried with what is happening in relation to a regular reality status. A lot of adaptation, a lot of work or changes in people's lives, whether it be the elderly or young people. And I think that, in fact, there is a level, I would say, the indicators seem to show an increase of alcohol consumption, the use of certain drugs. There's a level of anxiety which is greater in society, and I think that that is clear. And that is why we have to be able to, and I want to tell you that truly is the image, we are on a wire and we are in balance. So if on the one hand we want to slacken the measures in order to give hope and predictability back to people, but we generate so many cases that our healthcare system, I mean, that is where the entire balance is, and it's difficult. There's no specific recipe. And another thing, too, is that the regional epidemiology is different, and it's the case with all new viruses. The zones that are not as affected at first, they are more so later. So that is rather usual. So we have to take this into consideration, and we also have to, on our own end, we have to, before we give recommendations, we have to give tools so that people who are not in period of illness, of mental health, can live with the situation. But we are concerned in the same way that Dr. Drouin and the others, we are very concerned by the perverse effect of confinement. There is nobody who does not take this into consideration. But now the question is physical health, the healthcare system as well. Because it's not just physical health, it's a healthcare system. If it's overwhelmed, it's all sorts of other diseases that we won't be able to do, operations and such. So this is not an easy balance to keep, I'll tell you, there's no recipe, and that is why we have debates among ourselves for days and days, not to say weeks on end. You mentioned that elsewhere the situation is very difficult in the Saguenay-Lac-Saint-Jean. You know that restaurant owners over there are rebelling, despite the warnings that your vice or deputy premier said. Some have decided to open. There's even clients who have decided to have reservations. What message are you sending to them? Well, you have to respect the rules, and the police officers are going to make sure that the rules are respected. Tommy Chouinard, La Presse. Hello, Mr. Premier. I would like to talk to you about overmortality. You talked a lot during the first wave that basically your government presented, the death toll, so that the extra deaths was pretty much precise on the average of the past 5 years. So what we can observe here since the beginning of the second wave is that basically that excess mortality is superior to the extra deaths that we are recording with COVID-19. We analyze the data, and there's a good proportion of excess deaths that are not linked to COVID-19 since the beginning of the second wave, and if we compare with the average of the past 5 years. So there's an important gap here. So either the deaths are not taken into account, not entered properly, or there are extra deaths that are taking place that are not linked to COVID-19. and that could show a deterioration of many people's general state of health because they didn't go get care or they weren't able to get care. I'd like to have your analysis about this. What could explain this? Well, first, I wish to repeat what I've already said. Quebec, for many years, has been reputed to declare well, even better, the deaths associated to specific diseases, better than in the other Canadian provinces. Now, the numbers that you're talking about for the fall, very honestly, I haven't seen them, and I have not analyzed them, obviously. I don't know if you've seen them. I have not. So not necessarily in the same way, but is that something that we have to keep an eye on? Well, yes, that is one of the hypotheses, but there can be other factors as well that could explain that element. But I want to tell you very honestly, we asked to have charts and analyses as such. I have not yet received the results. But just so I understand properly, it has not appeared as being a problem on your radar screen up until now. That gap that we can see? Well, as I said, we would have to see the amplitude of the gap in order to be able to understand. So one of your hypotheses, if I follow the case that you're saying, is that because there's no access to certain care, there would be people who might have died of something other than COVID. What I feel anyway is that there's been no changes in our way of declaring cases as such. So I do not think that it's because we declare that we're not declaring the cases that we went down. But I have to make the analysis. I don't want to answer something that I haven't documented myself. Mr. Premier, just to come back to what you said, I want to understand properly. So when you said that after 2 weeks there might be a reevaluation, am I to understand that now that's not where we're at? That's not what I'm saying. First of all, we have not reached the 2-week mark yet. Second, we're going to continue following the results. However, the indication that I've given and the suggestion, the request that I made, is to perhaps open the door on individual meetings more than on those where there are potentials of gathering, like restaurants, gyms, and showrooms, or concert halls and such. But we do have the intention after 2 weeks of, yes, going over the data. Mr. Legault, an economic update next week. Ontario is coming with its budget this afternoon. What are the specific elements that you're going to be looking at that interest you most in that budget? Well, first, Ontario, if we look at proportions, they have a greater deficit than we have. You know that one of the big files that we've been studying is the entire question of the federal government's health transfers. We're looking here, we're talking about a lot of money. We are going from 22% of the funding to 35%. That's what's being asked. Of course, that could help Ontario eventually to resorb a part of its deficit. It'll be the same thing for Quebec. This is something that we have in common. Of course, we're all looking for the best means to relaunch the economy. So I look forward to looking at the measures that will be proposed in order to relaunch and kickstart the economy, including the entire qualification of the workforce, incentives to increase business investments, et cetera, et cetera. So I'm going to be looking at this. So I would say that, the size of the deficit and the link that has to be made with health expenses, health-related expenses, as well as economic incentives. Dr. Arruda, the Junior Major Hockey League of Quebec has submitted to you a project of tournament of 7 teams in red zone. I think I don't need to name them. You know them. They propose that it take place at the Videotron Centre in Quebec, perhaps in Shawinigan, which would be Plan B. What is your response? Will you give the green light to that? The discussions are ongoing. The public health teams, our teams, had specific concerns and linked with certain bubble protocols, and that is being discussed right now. We understand that the timeline is pretty tight. It's the 12th of November, and we are having discussions right now. I cannot comment on the final decision. So there's no final decision? No. My first question is for Dr. Arruda. We've been talking a lot, and we talked about it during the first wave, about community immunity. Now, nobody talks about that anymore. Where are we at in terms of statistics? At one point, we were at 3-4% of what you had evaluated of community immunity. Where are we at? Are those parameters that you continue following? Or have we completely left that aside? Well, it's going to be done by seroprevalence studies still. You understand that it's not really the priority right now because, in fact, what we are suspecting, first of all, is that the rates will never be at very high levels, not enough to prevent the virus from circulating. That is the first thing. We're not going to go from 3 or 5% to 85% unless everybody catches the disease and with the consequences that it means. The other element is that we realize that immunity might not be lasting. That is to say that beyond, there are reinfection cases, beyond 6 months. So that is an issue as such. So I'm not going to say, there will be seroprevalence studies conducted, but that is not what we are capitalizing on right now, unfortunately. We are going towards a vaccine or a treatment. That is where the solution lies. But we have no idea of the rate. Well, listen, I'll tell you very honestly, we also have to, for it to be worth it, there has to be a certain amount of time that the virus will have been circulating to do that because, these are samples taken in time to do that. But I do not suspect probably those who were low, for example, the regions that we just talked about that were more like virgin, if you will, they will go up from a rate that was at about 1 or below 1 to perhaps 3, 4, 5 max. My second question, what are you doing to make sure, because you spoke last week of the fact that there might be a vaccine sometime at the beginning of 2021, you spoke of February perhaps, that it was possible, that there is a possibility. What are we doing on the government side, Mr. Legault, to make sure that if in fact there is a vaccine that is available, regardless of what it is, that Quebecers will have access to it as well, and that we will be able to have doses that will be available here in Quebec and not just in the United States? We saw how the Trump government behaved, especially with masks, where they took everything. Where are we at? Well, maybe I can start, Mr. Lacroix, and Dr. Arruda can complete. Of course, we've already taken commitments with the federal government because it is the federal government that has the opportunity and the responsibility of speaking with the pharmaceutical companies, and that is what we made sure of having more than our share over the next few months. And in fact, what we're doing and what the federal government has been doing, if I explain it globally, is to try to sign with as many companies as possible because we never know basically who is going to be the first winner. So there's many agreements that have been signed by the federal government with the suppliers and between the federal government and ourselves to make sure that we do have our share. But right now, I would tell you that the big choice is going to be who's going to be the winner. But the kind of agreement that we've been signing are agreements that are confidential, and you'll understand why, but we are negotiating to make sure that we will have our share. I don't know if there's any other more important details. Well, like it was done with H1N1, we make sure that we have agreements with companies to have access with vaccines that will be reserved for Canada. And in terms of the agreements with the provinces and territories, my counterparts and myself, we're looking at the situation, and usually there's a distribution that is fair and equitable, based on indicators and as such. That doesn't mean that there won't be a vaccine that might arrive in the United States, a few weeks before, but we have already planned for that with many companies. I can't go into any further details, but that is how we work for the flu vaccine, but we've done it in pandemics, the H1N1. We have our own share, and we get deliveries at the same time as other provinces. Concerning the loosening of measures, Mr. Legault, you did not mention the cultural places like museums. Is that being thought about? Because these are not places of gatherings like restaurants. Not in the short term, not in the next few days. We consider that museums are also part of a potential gathering risk. And I also have a question about contact tracing. Dr. Marie-France Reynaud, who is a specialist in public health, says that Quebec is not doing that is not doing enough in terms of contact tracing. So I'd like to have your reaction on that. Well, contact tracing for me, I talk about it with Dr. Arruda and his team. I would like for us to do more. I would like for us to be better equipped. We said that we took additional tools and we're going to improve our platforms, and we already have a platform to follow contact tracing, and we will be taking additional tools to be able to do it more quickly. But we've already made big increases. It takes a lot of people to do that, and I'll just give you an example. We started publishing the number of outbreaks, and we put on our website the number of outbreaks that we have. And just to give you an idea, we have all over Quebec right now active outbreaks of about 1,400 active outbreaks. And if we look at Montreal, it's about 250, 300 active outbreaks. So imagine that each outbreak can sometimes have 2 cases or 5 cases, 10 cases. You can go up to 30, 50 people that we have to contact trace. So what we've managed to do as a first step is to be able to increase the number of people to do the follow-up of all those outbreaks. So we've more than doubled, and I explained earlier on, on the operational side, we have a new associate minister who is responsible for that. So a combination of more people, of having contact trace, of people who are at high risk. We focused on that. That is a change in the approach that we have made in the past few weeks, because it's at the beginning of an outbreak that we can find people the most quickly. Those who are further down the line are important, but not as important as the first one. So a combination of more people, of having, I would say, a more specific approach, tools that are being developed, the same tools that we have now set up in our screening centers. You know that we had a pilot project a few weeks ago that is going very well and that we are deploying for screening. It is the same platform that we are now evolving to include contact tracing. So I think that all of that together will make it that, in my sense, we'll have the best world practices to be able to have the best contact tracing as possible. And I agree with the comment that we can improve on that aspect.
Bonjour, Monsieur le Premier ministre. Peut-être d'abord, c'est possible.
Mr. Premier, would it be possible for you to specify whether there still is a question of going over the measures that were prolonged after the 28-day period? And my question is the following. Doesn't it put you in a bad mood to see that a document such as the one that was leaked from the Regional Direction of Public Health, to see that a document that is leaked that way comes and reinforces the idea that many have now that your decisions are taken, not as seriously as they could be? Well, first, 2 things. I think that Quebecers are sufficiently intelligent to know that there isn't any perfect response. So there can be many opinions in many different regions of Quebec. Of course, it brings a certain level of confusion, and that is not ideal as a situation. I think that it is important that discussions do not become possibilities of modifying measures, because we have debates every day on the possibilities of modifying measures. But when we modify measures, we announce them. We announce that we're modifying them. When we're just thinking about it, well, we don't want to confuse everybody thinking, out loud. Another element that I would add to that, and I think that is why it's important, I said it at the opposition this morning, to not create confusion. The reason why I'm saying that, and I totally respect the opinions that come to us, for example, from regional health, like that of Dr. Drouin. I congratulate her for her work. But the opinion that we emit for one region also has an impact. When Dr. Arruda makes his decision, he also has to think about what will happen in the Montérégie region and what will happen in the north of Montreal. So it's not just the public health opinion of Montreal, it's the entire region. And you know that we acted a lot when we took into account the metropolitan area factors. I just want to give you that example, that we can't create or help in creating confusion, whereas the opinion that is emitted by one group in particular has to be discussed with Dr. Arruda, and he, together with his team, will take all considerations into account that comes from the different public health directions. So I think it's important to think and to know that. Dr. Arruda, you remember after a request for access to information, the way in which you exchange with the other regional directors of public health, that was in the spring, it was the beginning of the crisis, there was that entire notion of emergency. But now we are in a new normal, and despite the fact that things are evolving quickly, wouldn't it be time that there be written documents, at least on a monthly basis, because we can see that it's done regionally in Montreal. So why not at the national level? So like reports. Well, the Montreal document, if you allow me, comes from discussions that we also had centrally. It's been a while now. We have charts, etc. I just want to say that if it's not done, it's just because of speed and evolution and adaptation. And the Montreal report did mention it, that the recommendations that are there depend on variables such as epidemiology. So I think that there are things that are documented, they are written as charts, etc. But as I was saying, it's not on what we usually expect in terms of a notice that we write an opinion with literature review and documentation. As we said, there isn't that as such, but there are written documents that do exist and that are submitted to the government. Maybe to go a little bit specify, but why not make them public if there's written documents that exist? Well, first, as we've often explained, it's a debate. It's not black or white. So since the beginning of the pandemic, we have had a lot of exchanges on a daily basis with public health. What I wish to reiterate and emphasize is that we have always followed the recommendations and even more. Now, I think that it is important that the public has a clear idea and that the communication be, that there is a single communication. And Dr. Arruda said it. The day in which the government won't be listening, he will say it. And it hasn't been the case in 8 months. We listened to national public health. I'd like to start with the outbreaks. I'd like to come back to that. Dr. Arruda, a few weeks ago, you mentioned that as far as working environments are concerned, it was most outbreaks, but I think there were only 12% of active cases that were linked to those specific outbreaks. Are you able to tell us, following along that same idea, with the active outbreaks, which report the most cases? Because we understand that, the work environments are perhaps smaller outbreaks. Well, first, it also has to be understood when we're talking about working environments, we also, it's healthcare as well, These are, it doesn't cover health and social services. It's the CNS who defines that. So it remains working environments that generate the most outbreaks. But care environments, because it has to be understood that in care environments, healthcare and others, we go in, we do important screening measures, and we detect many asymptomatic cases. So in healthcare centers, in an RPA, for example, a specific unit, we start testing, and we test 1,000 people. And in those people, we detect people who were asymptomatic, which is not always the same way of doing things than in other places. But it remains those environments that generate the most cases. And in those care environments, particularly for the elderly, that is unfortunately where there are the most deaths. And after that, there are cases in school environments, but that generate usually very little volume. Even in the screening after that, we do a lot of preventative measures. We close down classrooms and such, but there isn't that much transmission as such. But there is transmission in school environments because the school environment is, of course, open in the community. Mr. Legault, I'd like to come back to the comment that you made on the U.S. elections. You spoke of, well, in fact, you said that you wished for an appeasement. What do you mean? Are you expecting that social peace will be disturbed in the United States? What impact could it have on Quebec? Well, you can see as well as I can what the situation is. It's good for no one that there be such tensions between a society that is almost split in two, almost equally. So what I wish is that things quiet down, that society appeases itself, because it could, in fact, have negative impacts, including here.
Oui, bonjour. J'aimerais revenir.
I'd like to get back to the previous question concerning outbreaks and the new data that is available to make sure that I've understood properly. So those outbreaks, do they include all possible cases? Because, you can catch the COVID in the metro without knowing where it came from, and then it's not necessarily an outbreak, but, how is it counted? And same thing in schools or work environments. Can some cases be counted in more than one place? No. In school, it's the data is given, in one area, and we have specific data for the school environment. And of course, there are cases that we won't have been able to identify the source. We can't link it to a source, and then we'll call them community cases or unknown. That is when we can't trace them back. But when you have many cases or cases that are detected following screening in a workplace environment, or if you have, for example, an outbreak in a slaughterhouse where we have a specific story, then we can see it. There's a proportion of outbreaks, and there's a proportion sometimes that is community. On another subject, Mr. Premier, concerning the departure of Ms. Murphy that was announced in the middle of an election day, don't you find it strange the time that this decision was announced in the middle of a media eclipse, if you will? And don't you think that it might decrease the confidence of the public in institutions if we add what happened at the SQ, for example, everything having to do with the status of the general and what happened at the UPAC? There's like an accumulation of what is going on, and that has to do with all the different police forces. Well, first, I don't think that the political arena should make comments on the SQ or the DPCP or the SQ. We had to be prudent. However, I agree with the impression that Quebecers have that there are a lot of questions being asked, and that there is work to be done at the UPAC, for example, to get back a certain credibility, but I do not have the intention. I mean, the only thing that we'll do is that the following person who will be responsible for the DPCP will consult the opposition party, and as we said in our Bill 1, it will be a two-third vote. When you say that don't have the intention, you didn't finish a sentence. So there's nothing that the government can do, if I understand correctly? Apart from naming the person responsible of the DPCP, I'm not going to start asking questions. Why did you make such and such a decision? They are independent and must remain so. We will now go to English questions.
Good day. I have a little scientific question for Dr. Arruda, since you're the expert. Health Canada is now talking more that aerosols are a risk. I'm sure you saw this. But I believe you said, or Health Santé Québec said that they're less concerned about the transmission through aerosols. So why does Quebec think it is less significant than some of the other experts?
In fact, we have never neglected the fact that it could happen, and there is specific situations for this. Even the Institut National de Santé Publique already in August had talked about ventilation and aerosols, especially in crowded places with close contact and everything. But that's not the principal driver of the infection. And we are agree with those issues, but it's not the principal, I would say, mode of transmission. But in certain conditions, very, very close places with high contact, and low ventilation, aerosol could be one kind of spreading that could, but it's not the principal driver.
And for Premier Legault, you made remarks about the United States. Are you concerned that the instability we are seeing every day there could affect Quebec's economy?
Yes. I think we would like to have a final result as soon as possible, but it's more than that. I think that right now we see that the people are very divided, 50-50 or 50-48, and we have to have some lessons from those results. I think that many citizens worry about their job, especially in the manufacturing business. And we have to keep that in mind also in Quebec.
CTV.
Good afternoon. I wanted to ask about the Montreal report. So just to be clear, has Montreal made a recommendation to have some things lifted, has some restrictions lifted, and what would it take to get there if that's not the case already?
Maybe I can start. There are two steps. First, we need to have a recommendation from Dr. Arruda from the national level. Second, we have to accept it, and the final decision is taken by the government. So we're only at the first step.
As a big team, they make a report with some recommendations based on when they did it, and it's written there that it must be looked at in the fact if there is other epidemiology. We have discussion that Dr. Drouin is with us every day with all the directors, even to know are we going to go red in that place or not exactly. And the work of what could be the different I would say adjustments to the palier colors and things is not well finished at my level with all the directors of public health and with my special conseiller now. So when I will finish, even if this is one input, we've got others input from others, we are trying to have a coherence and consensus, because just understanding that if we do something in Montreal, there is impacts in Laval, there is impacts in Longueuil. So it's important to have this and take into account all that issues. The same way that it is important also to take into account Outaouais, which is just besides Ottawa. That's the way it works.
And on these potential one-on-one meetings that we can have with friends, you said that could be something that happens soon. What would that look like at a first stage? Could everyone in a household meet one other person? Would it have to be only one person, not one person a different time, and then the next day someone else?
First, we have to remember that right now already people living alone, they are allowed to receive one person, one visitor. So that's clear. But what I understood and what I listened and what I heard from, for example, students at college and university levels, they live with their parents, so they're not alone, but they don't go to college or university and they don't meet their friends since many months now. So what I've asked those two people for is there a way that we can find a possibility of permitting those meetings one by one. But at the same time, I wanted to emphasize why we took the decision to close restaurants, gyms, and theaters. It's because there's a potential risk for gatherings, and the real risk and the important risk is about gatherings with 10 people. One-on-one, maybe we can do something, and we'll come back to you soon.
Raquel Fletcher, Global.
Good afternoon. I actually wanted to follow up on that point, Premier. So you said that it's not necessarily about people gathering, but that it's the opportunity exists for there to be gatherings. I'm not sure that I quite understand that in the context of, say, gyms or libraries or museums. If someone's going to work out, lift weights, for instance, normally they go out, they go to the gym, they lift weights, they go home. Are you really concerned about people hanging out in the parking lot after the gym, having a party, or hanging out outside of the library?
But I went to gyms, and you know, when you go often to the gym, you know the other clients. You become friends, and of course you want to talk with them during the time you're there, before, after. So yes, there's a potential gatherings possibility. Yeah.
On what you said about the U.S. election, you also mentioned that you want Quebec to become less dependent on.
That's not okay. Go.
Or more independent, should I say more independent when it comes to importing and exporting?
What I said is that we hear very often speeches about trying to be less dependent from United States, but we have to realize that we will always have a very important partner, and even we can export more to United States. We're doing a lot to Northeast states right now. But for example, if you talk about Texas, if you look for the last 5 or 10 years, the growth in Texas, it's an opportunity that we have for Quebec companies to export more in Texas. So we have to be realistic. First, we are a winner with the exchanges with United States because we have a surplus of $20 billion a year, compare with a deficit of $30 billion with the rest of the world. So in total, we're at -10, but we're lucky and we need to keep this relationship with United States.
But is it in jeopardy now because of the
Of course, whoever wins, Biden or Trump, in the history, Democrats were more for protectionism than the Republicans. But for the last 4 years, we had a Republican president that was a lot supporting protectionism. So whoever is winning, Biden or Trump, will have to continue fighting. And I think the key is really to also keep good relationship with Charlie Baker, with Cuomo, with Newsom, with Abbott, with the governors of the different states, because our two economies are linked very much. And you can see very often the same product going from one country to the other 4 or 5 times before it's finished.
Merci. Cathy Sonnet, CBC.
Hi, good afternoon. I would like to go back to a question that you received last week by Tommy Chouinard. The number of deaths in CHSLDs in the second wave versus the people dying at home. We have the numbers from the ENSPQ. And so you see that, so the people dying in CHSLDs during the second wave is much lower than in the spring, but the number of people dying who are living at home is high. And we see that the numbers of deaths of people living at home are basically increasing steadily since the end of September. So, I mean, is it because of community transmission? What is your understanding about those deaths of people living at home of COVID-19? What's your understanding? And do you have the impression that it's because of community transmission, first of all? That's my first question.
Okay, what I've explained to Tommy Chouinard, and I'll try to repeat it.
I do have what you said.
Okay.
But I would like you to go further.
Maybe I was not clear enough. So
well, I didn't thought that you went further enough, Mr. Legault. Okay. With all the respect I have for you.
Okay, so I think that the increase in percentage of the number of people infected in homes, okay, doesn't mean that you have more people infected in homes. The main reason why the percentage is increasing, it's because the number of people infected in CHSLD dropped a lot.
Okay. But that doesn't answer why
you don't have more people infected in homes than in the spring. But the percentage is higher because the percentage and the numbers of people infected in CHSLD dropped a lot.
Okay, but at the same time, people living in CHSLDs, they do have healthcare workers around. Do you have any concerns of people, because you know about the community transmission, older people getting sick? Is there any concerns that some people vulnerable are not asking for help and you may have more deaths because of that? Or the care?
We don't have more deaths. If I can give you a figures, all right? If you had 100 deaths in the spring, 80 from the CHSLD and 20 from homes. If right now you have 10 from CHSLD and 20 from home, of course it represents 2/3 instead of 20%, but it doesn't mean that the number of people infected is higher.
Okay.
Follow me?
Yeah.
Okay.
Can I have one last clarification? Yeah. The document from the public health, Montreal Public Health, was also talking about a long-term vision so people can live with the virus. And we need that. So you're not ready yet?
But maybe what I could say is that, sure, we always talk about a new normality, and remember we've been talking a lot about that. I think the goal is to make sure that we understand that we unfortunately gonna live with this virus until there is a vaccine. So we all know that. That's unfortunate, but that's the way. I think that we have not yet come to a place where we're comfortable at the level where we should be, okay? I think that what our challenge, and that's the reason I like what the challenge that the Premier gave us, is to say, are there any some adjustment that we could do? Because we will have to live with that for a while. And I'm just going to make a big difference with the first wave. Remember the first wave when we had confinement? We were not going to school, people were not working, and we were not having displacement. The reality today, even though if we don't like it, we are still able to work. Our economy is doing a lot better than we thought it would. Our kids are at 97% at school. So this is a new normality on the positive side. On the negative side, I think that we need to find the Premier always said, how do we balance this? So I think that if we're able, and that's the reason I always said that the month of November was a good test for us, is can we find this new normality in terms of now having all those measures, but continuing to live. If at one point it means that we can have additional contacts that are not to, I'd say, a minimum impact on the gathering, this is what we're trying to find. So, I don't know what the vaccine will be this spring, next year. So this is what I'm trying to answer is, where is that new normality that people can do? On the positive side, the schools and everything, but on the negatives, what are those measures that we need to keep to make sure that we protect everyone? That's the new normality would be the key word.
Alors, c'est ce qui me fait un point de
So this puts an end to the press conference. Thank you very much to everyone.